Hi.
Hi.
Hi. And hello to anyone out there who might be watching us today. And hi, everyone. I'm just so happy to have you along for what I know is going to, if you're a woman having a baby, it's going to be a very valuable time for you. So I'm Rebecca McQueen from Birth Sense Australia, and I'm so happy to be joined by Melbourne-based pelvic floor physiotherapist Jessica Kostos. Welcome, Jess.
Thank you. Thanks so much for having me. I'm really excited to chat to you today.
As am I. Thank you so much for joining us. Let me tell everyone a little bit about you. So, Jess, you're also known as the Mama Physio. I love that name. After graduating with honours at the University of Melbourne in 2012, you've since completed postgraduate qualifications in pelvic floor physiotherapy and have worked overseas in public and private practices. So, and we were saying before, you've recently returned from the UK, where you've been working for the Australian Physiotherapy and Pilates Institute as a consultant physiotherapist. That's a big job.
Yeah, it was amazing experience being overseas.
Brilliant. There's nothing better than doing some work overseas, but we're glad you're back with everything that's going on in the world now.
Yes, same here.
Yeah.
Good timing.
Exactly. So, Jess, for those of you who are watching, Jess has a special interest in treating women's health, pelvic and spinal conditions, and her clinical approach combines evidence-based physiotherapy with clinical Pilates, dry needling, acupuncture, education, and specific rehabilitation to treat, manage and promote wellbeing. Does that sound right, Jess?
Yes, it does. Thank you. Thanks for the great introduction.
Oh, pleasure. Look, the thing that took me about your bio when I read what you did is your passion for helping everyone of all ages achieve their optimal health and well-being in your role as a women's health physiotherapist.
Yeah, it's a very rewarding job, definitely. Yeah.
You know, Jess, I was, as we mentioned earlier, I said, look, I wonder if everybody out there even knows exactly what a women's health physio is.
No. Do you know what? Like, most people come in and they've been referred and I say, oh, do you know what a women's health physio does? And they're like, I actually don't. And so I have to kind of go through that. And do you want me to explain what a women's health physio does?
I think so. If you could just give us a bit of an executive summary of your role and what you do day to day.
Yeah, so I'm a pelvic floor physio. So pretty much I will treat anything related to the pelvis or the pelvic floor. It can be men or women or pediatrics. I suppose my special interest is women. Generally, like the type of conditions I'll see are things related to the bladder, so like leakage or a prolapse, childbirth injuries, anything to do with the bowels, constipation, IBS, things like that. And also see people with prolapse, pre-post surgery, pain in the area, like huge, like more than what a lot of people would think physios can treat. It's quite holistic as well. Like we kind of act as case managers and kind of bring together like the GP, the continence nurse, the specialist, things like that. So it's really rewarding job. Yeah.
And would be different day to day for everyone with their different needs coming in and their different healthcare providers that you're bringing together. So thank you for telling us exactly what it is that you do.
Yeah, that's okay.
Yeah, look, one of the things that we're going to talk about today is something that's really important to women when they're having a baby. It's an area that often people don't think about very much until they really have to. And we're going to talk about today what we can do or women can do to protect the pelvic floor, and that part of the pelvic floor we're going to talk about specifically is the perineum. So tell me, first of all, again, where is the perineum?
So the perineum is, so if we're thinking about the pelvic floor, so it's like a sling of muscles from your pubic bone to your tailbone across here, and there's openings. There's an opening for your bladder, your urethra, uterus and vagina, and then your rectum. The perineum is the bit between your vagina and your back passage. So like with a pelvic floor assessment, it's the bit that draws in and drops down if I'm looking visually. And it's really common in childbirth, in vaginal deliveries, to have injury to the perineum. And there's things you can do to prevent injuries and prevent it getting worse in terms of stages of injuries as well, which, we'll go through today.
Okay. So, well, tell us then, what is perineal trauma?
So perineal trauma can be, so generally speaking, we have different grades. There's a grade 1, which is just a little bit of a tear, generally doesn't involve stitches. So it's quite common to have this in delivery. Grade 2 is a little bit more extensive, and pretty much the tear can be anywhere in the vaginal area, but it doesn't extend into the anal sphincter. And most people get like a few stitches with that. A grade 3 tear has grade 3 A, B, C, and the grade 3 tear goes into the anal sphincter, different degrees depending on A, B, C. And this means because it goes into the anal sphincter, it's really common to get issues with your bowels or urgency, or even if it's not now, it might be later in life. And a grade 4 tear is the whole way through into the internal anal sphincter, which, can be devastating and can have lifelong consequences. I suppose as well, perineal trauma also encompasses having an episiotomy. But, episiotomies, and we'll talk a bit more about that, are generally done to prevent you getting those grade 3 and grade 4 tears. So they can be preventative even though they're considered trauma.
So I know when I was pregnant, and for anyone out there who's listening right now and hearing this information, they'll be thinking, I don't want that. That doesn't sound good. That is actually frightening for some, and we want to avoid it. So why, you've gone through some of the reasons why we want to avoid it. Is there anything else you want to add to that long list of the good reasons why we want to?
I suppose it's preventing any bladder bowel issues later in life, and prolapse, and, consequences I'll normally see might be like pain with sexual intercourse, or, bowel issues, bladder issues, or, a lot of the time it might come up later in life, like post-menopause. And so the issue is, like, because people don't have issues now, they generally tend to kind of push pelvic floor exercises to the side. Whereas right now, when you're fit and healthy and you're young, it's the best time to be working on it.
Yeah, that makes sense. While you've got the good muscle tone to work with and retrain. Okay.
Yeah.
Makes very good sense. What is an episiotomy, Jess? Let's talk about that for parents at home.
Yeah. So an episiotomy is a snip, and it's always on the right side, well, most of the time, and it's a snip, and it's like anterolateral or diagonal from away from the back passage. So if I'm looking down at someone, I'm kind of going to the side away from the back passage. Essentially, like if there's issues with the baby delivering, or woman's not dilating, or they're at risk of tearing, the nurse or the obstetrician or midwife will do an episiotomy to prevent tearing towards the back passage. But it might also allow for someone to use forceps or ventouse to help with an instrumental delivery. I think a lot of ladies, it's done to prevent that, like the grade 3 and 4 degree tear. It's not necessarily a bad thing. I think a lot of people in their birth plan will be like, I really don't want an episiotomy, but it's probably the better option than having those 3rd and 4th degree tears. And it's a clean slice. They've done in a specific direction to avoid any nerve injuries as well. And because it's a clean slice, it generally heals a lot better as well. Yes, it's painful, and yes, it takes a while to heal, but it's kind of your better option, I'd say.
So it's certainly an area of interest in literature, whether episiotomy is better than maybe a bit of a tear where this tissue can come back together, more in a natural fashion rather than a surgical incision. Yeah. And to me, it seems to keep changing the evidence. At the moment, where are we at with what the evidence says around normal tear versus episiotomy and healing?
Well, I suppose really depends on it depends on what degree the tearing is, and like there's so many factors that come into it, because you might allow for a natural tear, but it also depends on the midwife, like the team that's there at the time, and how they're diagnosing it and how they're stitching it, and the care instructions they're giving you as well. So some people might allow for a natural tear, and it might be misdiagnosed as a grade 1 or 2 when actually it's a grade 3 or 4. Yeah. So yeah, it's at the moment it really depends. it depends kind of on so many factors. And also as well, like, you know, you can do whatever you want to prevent a childbirth injury, but at the end of the day, it's like the safety of you and your baby as well. So yeah, there's lots of factors that come into play.
Yeah, and I would imagine it's very difficult for the healthcare providers to predict, is this going to be 1, 2, 3 or 4? Would that be correct? Or when do they make that decision?
I suppose, like, there aren't really any predictive, well, there are predictive factors, but, you know, clinically, if I'm seeing someone already who's having issues with their pelvic floor, whether it be it's quite overactive, so they've had pain in the area in the past, or bladder or bowel issues, or it's non-relaxing or things like that, or it's a really fast delivery, that's kind of what I'm thinking about in terms of, you know, it's potentially at risk of a higher grade tear.
Yeah. Well, all of that information is really valuable, and, you know, it's important to empower women with this information. But let's talk about what we can do to maybe prevent tear happening in the first place, or episiotomy happening, because there are some things that can be done. So tell us about those tips that you have out there for women listening.
Yeah. So the first one would be perineal massage. I'm not too sure if many people know about it. Essentially, there's good evidence that it does help. I normally tell my mothers who I'll chat to about it to start from about 34 weeks onwards. There's some great resources if you're looking online, and, you know, you can speak to either of us to get specifics, but essentially what you'll do is normally I'll get someone's partner to help, because I think towards the end of the pregnancy it's a bit hard to reach down there.
Yep.
But, you know, using some oil, like coconut oil, almond oil, or a lubricant, and, you know, massaging that area between the vagina and the back passage, because really, like, that's the bit, if you're thinking about the sling of the pelvic floor muscles, this bit here is the bit that stretches the most.
Yeah.
So that's the bit that we want to make sure it has extensibility in that area. And, you know, it can be a great thing that you can do, and I've seen clinically as well, I've seen lots of people have great results with it.
Okay, so you mentioned that people could come and see yourself or someone like yourself, or are there any online resources around how to do it specifically that you could guide people to?
Yes, so having come back from the UK recently, there's quite a few UK pamphlets which I'll normally print off, because they're great. They have like pictures and everything of what to do, because most people need that. I will normally put into Google like NHS perineal tears, and that will be the first thing that comes up. But I think that's something I might be posting, actually. That'd be a good thing to post. I might post that soon, because I think that's really helpful. And a lot of the time, for someone who's struggling and is a bit unsure, that's something I might do in clinic. I might actually do an internal examination, do a perineal massage, so they kind of get a sense for what it's meant to feel like. And also it's a bit of an assessment as well. You know, I can tell how much extensibility there is in the tissue by doing that as well.
Yeah, great. That sounds like a great post that a lot of people would love to hear and have access to that information. So if they're starting from 34 weeks, and then how often should they do it? Is it a daily thing, twice daily? What's your recommendation?
Yeah, so it's really conflicting how much and how often. I would say daily. I would say, like, get it into your routine, like when you have a shower or bath, because the body's hot and warm already and extensible, do it straight after then, and just get into the routine of doing it regularly. And you know, you've got to be doing it for at least 5 minutes to get a good amount of blood flow into that area as well.
Okay, and that's the protective factor, is it the blood flow coming into the area and making those muscles more pliable, is that right?
Yeah, it's the ligaments and the ligaments and the tissues down there. You obviously want to get a bit of like blood flow into there, but also just some like extensibility in that area, and for it to be able to stretch as well. And, you know, a lot of people are just kind of like holding everything in, especially towards the end of the pregnancy, when it might feel a bit heavy down there, or there might be a bit of leakage. People are just holding on all the time. And you know, to be able to deliver, you need to be able to lengthen and relax as well as contract. So you know, it's really helpful for that.
So just something you've said that's a little bit off tangent. Sometimes people think if they've had a cesarean that they don't really need to see a women's health physio, but what you've just mentioned then is it's the weight of the baby and that heaviness on the pelvic floor that can also cause some issues later down the track if things aren't looked at. So this isn't just a talk for mums who are having vaginal birth.
Yeah. And I see it all the time. People come, I do lots of 6-week checks, and people come in and go, oh, I don't need an internal examination because I've had a cesarean. And I say to them, you do realize, like, you held, let's say, somewhere between like 10 to 30 kilos extra on your pelvic floor for up to 9 months. You know, it is likely there's a bit of leak here, there's a little bit of weakness or something, a deficit there. So yeah, it's not specifically the vaginal birth itself, it encompasses pregnancy. Yeah.
So just tell us back to things that women can do to prevent injury.
Yeah, so the next thing would be an active first stage of labour. I suppose you could talk a little bit about that though, couldn't you? Because that kind of encompasses your course.
Yeah, so yeah, it definitely does. So the term active labour was coined in the 1980s by an antenatal educator by the name of Janet Velasquez, and her way of teaching women was to encourage them to get off the bed. You actually doesn't often feel that good to be in bed anyway when you're in labour. That was a culturally enforced idea way back in one of the King Louis, I think it was, wanted to see the birth of his baby, so mum was put on it back. And that has sort of left a legacy for a long time for women in birth, of this idea of being in bed on your back. And Janet Velasquez questioned that and said, well, what would women do if they weren't told what to do? And often it's instinctual rocking, swaying, moving around, getting up off the bed. That's how it's very, most women do it, even if they haven't done an active birth course, they'll do it if they're left to their own devices. So it was all about using those instinctive positions, which is more of an upright position more often, maybe on a birth ball, maybe standing, hanging on to your partner, rocking, swaying during your contractions or your surges or whatever you want to call them. And it's also about using some relaxation techniques as well to go into that zone. So that's what active birth means, and what it can do when women utilise these positions is increase the diameter of the pelvis up to 30%, and that's going to that's a large amount for babies to then be able to descend and for birth to go in a way that requires less intervention. So so active birth is got some great evidence behind it to reduce that risk of interventions being needed. So you're
and I suppose, like, those interventions, like, you know, having the active birth helps with that pain relief and everything as well, like, is less likely to result in like an epidural or something, let's say, which then puts you at risk of having a childbirth injury. So
it's that cascade of intervention that we hear about, and it's stopping the need for epidural, the need to lie down, the need for instruments. That is why active birthing can be a good way around protecting your perineum.
It's great.
That really that makes sense. So what is the risk of perineal injury if women don't use those active birthing strategies? I might be putting you on the spot asking for that, and if I am, tell me to get back in my box, but do you have a rough idea? Does it like double the risk, or?
The risk, I have it written down here. So the active first stage of labour has been shown to prevent epidural. The epidural is linked with an increased risk of perineal trauma threefold, and increased risk of instrumental use. So that's quite a lot. Yeah.
It is a lot. And epidurals certainly have their place, and they can be a fabulous technology. But I think it's really important that parents and women hear that the risk of using one can then send you down that cascade of intervention path. And so it's nothing's perfect in this world, and it's good to know the pros and cons of everything.
Yeah. Yeah.
So is there, keep going, Jess, like what else have you got to tell us?
So I suppose that comes into optimal positions, and you already kind of touched on that with the upright active labour. And, you know, in terms of there are positions in labour that help prevent childbirth injury, and the benefit of being in an upright position, which would include like squatting or kneeling, or kind of like leaning forward over something, you know, or, you know, holding on to partner or a football, or even standing. Being in the upright positions helps prevent the use of epidural, episiotomy and instruments. So it prevents that cascade. Being upright though, sometimes there can be an increased like risk of like smaller tears, just because it can be quite fast or precipitate. But, you know, if you've got a good team there, they're going to kind of slow that down. But again, you know, it helps prevent that cascade. Yeah.
And that's why I'm big fan of people going on to a birth class and learning these skills, because they are skills. They're not innate natural talents. They're just a matter of learning what a contraction is, how to use some skills to apply it in that short moment in time when your body's doing work. So, okay.
I think it's just listening to your body, isn't it? Tuning into it.
It is. It's about that. Well, I mean, I've been in this area for a long time, and I look at the different ways. There's calm birth, there's hypnobirthing, there's active birthing, there's all these Lamars, Australia is out there now, and I'm a big fan of the mindfulness side of things. But I think at the end of the day that all of these classes aim to do that, aim to quiet the mind and tune into what's going on in the body and work with it rather than fighting against it. So, and I think too that these skills can be good for birth, good for life. So, yeah.
100%.
Yeah. So,
100%.
yeah. So you mentioned when we were speaking earlier about the breath and what it is about the breath, which I know is tied into what I've said before about breathing, about relaxing into your body and that active birthing techniques. But it really is the foundation of all of those different class styles that I just mentioned before. What has research shown around women's health and using that type of technique specifically, Jess?
The breath, using the breath during delivery.
Yeah. And how does it help the perineum, I guess, is where I need to come back to.
Yeah, so again, so this has all come from a Cochrane review that was in 2017. So relaxation, acupuncture and breathing techniques, so things that kind of like help calm your body and bring you back into that mindful state, have been shown to help with, you know, instrumental, needing instruments and all those interventions kind of going down that cascade. And I said it really nicely ties into the active side of the labour and, you know, these mindfulness which you're talking about, because it just comes down to listening to your body. I don't have the specific statistics on it, but in terms of, you know, how it helps, like we were discussing about this earlier, in terms of getting your body in that relaxed, calm state so it can do what it wants. And it's kind of looking at that nervous system level as well. Yeah.
It's I think that in my classes gone by, when I've spoken about the nervous system and how it impacts on birth, people are often very interested and quite surprised at that connection of what your nervous system is doing and then how that translates into the body. And
like I have a good example like one of my friends, she's a women's health osteopath actually, and you know, she's so informed with everything, really in tune with her body. She really wanted a home birth. This is over in the UK, and yeah, the moment she went to the hospital, like she was like really like right towards the end, but you know, was getting really tired, so was like going to the hospital just in case she needed some intervention. And the moment she got into hospital, everything just slowed down and regressed, because it was that mental state of like, you know, I don't feel safe, there's people watching me in this room, my house is my safe environment. Yeah, and I suppose that kind of leads into it, doesn't it, that nervous system effect.
Yeah, that story is so common about women at home and they're going fine and they think, yeah, it's time to go in, jump into the car, and on the way from home to the hospital, something shifts for them and it impacts on their hormones. So the best explanation, I think, is to think about the brain and the nervous system as having two gears. So gear one is your sympathetic nervous system, and that's where fight or flight exists, and hormones like adrenaline and cortisol start to come into play. And it's a really important body system to keep us safe and survival, and we need it. But it's the direct opposite gear that the brain needs to be in for birthing, which is in the parasympathetic nervous system, which is where feelings of safety, of love, of trust exist, and being calm. And that's when you have the hormone of oxytocin, which is the hormone of love and breastfeeding and labour progression. So that move from home to car to hospital can put a woman in a more of an alert state in the car, looking around, are we going to get there in time? How am I going to manage this contraction if we're driving? And she gets to the hospital and things slow down. So that's okay, because you can get back into the mindset that you need to be in for birthing if you've got some skills and tools to do that.
And I love, like, I don't have any children, but I've done so much on mindfulness and the parasympathetic system. Like, I'm so interested in it just because it helps my patients, it helps any condition really, like especially chronic pains anywhere in the body. And it is a skill. Like, it isn't something you can learn the week before you deliver. You do need to practice it, but it definitely works, definitely.
Yeah, I think that's why I've lent towards the mindfulness side of things with what I'm doing. The evidence behind it is very compelling, certainly for birth, but also for stress and for traumatic events. It's being shown to be the thing. And I think what I like about it is sometimes people say about meditation, oh, I can't meditate, I can't switch my brain off. But mindfulness is something that is, I think, easier to achieve, and you can do it anywhere, in the car.
Yeah.
Now.
And you can do it for 2 minutes if you want. Like, you know, it doesn't have to be this half an hour long process. Yeah. Yeah. Once it's a skill, you can just do it. Yeah.
That's right. That's it. It's a muscle. Again, it's about a muscle being exercised until it becomes part of who you are and what you do. So, yeah, that idea of going to a birth class is going to help you, I think, later on down the track, as well as for birth, pregnancy, parenting, all of that. So not one-eyed at all.
Yeah. Yeah.
So what else, Jess, is there that we can do, or women can do, or have we got to the end of the list perhaps of
I've got a few more here actually.
Oh, good. Yep.
So using a warm compress, so you know, like a face washer or something that's been in warm water or something like that, and holding it against the perineum. They do it quite commonly in the hospital. So a lot of the time, if you say to your midwife, you know, do you have one, or ask them, or they might even use it and you haven't even noticed, to be honest. But holding it against there, and again, it's kind of like that perineal massage in terms of like bringing some blood flow into the area, extensibility. We know, like, you know, it's even like warming up before exercise, don't you? You do a bit of a warm up to prevent injuries. Same thing for, you know, doing your marathon, which is birth. Putting a warm compress, there's been evidence to show that moderate quality evidence that it helps prevent 3rd and 4th degree tears. It's uncertain about like the smaller grazes and, you know, unstitchable ones, but you know, you want to prevent those bigger tears, and there's good, it's an easy thing to do. Great one to add into your birth plan.
Yeah, fantastic. And like you say, it can sometimes be a case of asking for that. It's a very low intervention thing to do, and it just feels really nice, I have to say. Yeah.
I suppose like they're kind of the evidence-based things. There's a few other things people do to try and prevent childbirth injuries, which there's not really that much evidence for or against them, but like, you know, not going to hurt if you use them. Have you heard of the Epino?
Yes, I have. So yeah, tell us more about it.
Yes, the Epino, do you know what? I've got one upstairs. I'm not going to run up. It's pretty much, it's a balloon, I suppose. Like, it looks like a blood pressure cuff. And you put it into the vagina and you actually pump it up, and there's like a dial, and you want to try and pump it up centimeters, and you can kind of practice dilating the tissues in that area. And I suppose, like, there's not really evidence to say that it's for or against it, really. There's not really any difference, but if it's going to help you mentally get over that challenge of resisting some stretching in the area, why not? Yeah, I think clinically, I've seen ladies who love it. I've seen ladies who've used it and had tears. It doesn't really have any, it doesn't really have anything to say not to use it, I suppose.
So with the so it's like a perineal trainer.
Yes.
So when would women start doing the training and gradually increasing to 10 centimeters? Is that the recommendation?
Yeah, it's like 9 or 10 centimeters. Generally, I'd say from like 36, 37 weeks onwards, practice using it. And generally what people do, you know, the first time you might get up to 5 centimeters, and I'll normally tell someone to kind of like slowly pump it up, use your techniques and your skills that you've learnt in terms of mindfulness and relaxing the area, and kind of breathe into it, allow your body to kind of get accustomed to that diameter, and then maybe pump it up a bit more. And then you might get to 6 centimeters and that's enough for today, and then try a bit more. And, you know, you can even team it up with, put your hot compress on, do a bit of perineal massage first, and then use the Epino. You know, it's just preparing.
Okay. So one question that I've had about the Epino for a while is, are there any long-term studies that you're aware of around women who've used it and how their pelvic floor has held up over the years, or is it too new? No,
there's no long-term studies. And I think the studies that came out originally with it that were saying, oh, it prevents trauma in this percent and everything, I suppose you've got to take it with a bit of grain of salt and caution, because the study was done by the company itself. And it hasn't been out for that long. I don't know, how long have I heard about it for? Maybe like 5 years or something? I'm not too sure. There's a few competing ones. Do you know how long it's been out for?
No, look, I only became aware of it. Well, I became aware of it 10 years ago when I first got into this space of teaching childbirth ed, but I feel it was fairly new around that time. Yeah, which
it's a lot more well known now, isn't it?
Yes, it is. And like you say, some people swear by it. Some people just say that's just not for me. So it's about doing what you want to do. And yeah, talking.
And really, it's no harm done, is it? You know, if you want to try it, try it.
Yeah, that's right. If you're working with a healthcare professional, then as long as you're being safe with everything, then it's about choosing what's right for you. So okay. So all right. So there's some great tips around prevention and protection. How can acupuncture be of any help in this particular thing we're talking about with perineal health?
Chinese acupuncture can be helpful in terms of, so that kind of comes into your relaxation and breathing. So your Chinese acupuncture has quite good amount of evidence in terms of showing that it, calming the nervous system. So again, it's that same thing we were talking about earlier with your 2 gears, and you kind of want to get yourself into the slower parasympathetic gear.
Yeah. Okay. Yes. So all right. So if we've done everything that we can around being prepared and doing what we can around your pelvic floor health, talk to us about post-birth. What is it that women can do to also continue that care of self?
Yeah. So I suppose, like we said earlier, you can do all you can to try and prevent a childbirth injury, but you've got to remember as well, the number one priority is kind of like safe baby safe mother. So, you know, don't get yourself down if you do end up with an episiotomy, or you do end up with forceps, and you do end up with third-degree tear. Just make sure you're doing all the right things postnatally. Most hospitals have like a postnatal education class, which I definitely recommend going to. I did run one at a hospital for 2 years, and I've got to say, I think like the mindset of a lady after her delivery, it's just not on her radar. Every now and again you'll get someone in, but like I'll see that I would book them in for a 6-week check, and they'll come in and they'll be like, I wish someone told me after my delivery. And I was like, I did. I didn't say that to them, but I just don't think they're in the right mental state to be able to absorb that information. So I think the best time to absorb it is before you even deliver, actually. So the first thing I would normally recommend is you can start your pelvic floor exercises after you've done your first wee and the catheter's out. So starting gentle. And I normally recommend start with your definitely recommend you should be doing pelvic floor exercises before your delivery. So especially so you know what they feel like. But after, let's just say before you could hold for 10, 20 seconds. After, don't get down on yourself. Before you can do is like a flicker on and off. That's pretty normal considering how much the pelvic floor stretched. The pelvic floor actually stretches 300% of its resting state. So, you know, it's the only muscle in the body that can stretch that far. So it's done a pretty good job. You just want to try and get a bit, the idea of starting with your pelvic floor exercises to get a bit of blood flow to the area and the nerves to kind of come back into the area and kind of switch them back on to what they're meant to be doing. So starting with your pelvic floor exercise, just gentle, on, off, on, off. I don't know. Have you heard of the app called Squeezy? No. So the app called Squeezy is an NHS app, but it's pretty much used internationally. I think it costs about $2 or something. It is definitely worth it. It's an app that gives you like a reminder and alarm in your phone, and when it goes off, you can kind of press play and you just sit there and watch it. I know, I think most ladies will say it's better than having to remember mentally, because, you know, when they start sitting down while they're feeding and doing it, you kind of get a bit bored. So if they've got something to follow through. So I would recommend get an app like that. Start straight away, slowly build up. In terms of toileting, directly after, I'll normally tell people who've got tears to kind of like wrap some paper around their fingers and kind of hold the area to support it if they're a little bit worried, and, you know, have a shower after, wash with some water. That helps in terms of like preventing infection and things, because that will affect your healing. Support garments are great as well. So your Spank, shapewear, there are some brands that have like support postnatal wear. They're great, but like any support underwear is going to help. The support from underneath and the support from the stomach muscles perspective, I kind of compare it to like a cut, a gaping cut, because some people are kind of foreign against their support garments. If I think about a cut though, if it's open and I get a Band-Aid or a Steri-Strip and pull it together, it's going to heal a lot better. So I just say that to my ladies, look, you know, in terms of your stomach muscles, they're stretched. If we hold them where we want them to heal to, the same with underneath, and support them, it's probably going to heal a bit better than just being left to its own devices. What you can do to support underneath is tell people to put like an extra pad or two into their underwear, just if they feel they need that extra lift and support. Yeah, and then preventing, like avoiding things which are going to put pressure on the pelvic floor. So avoiding constipation, which is really common after delivery. If you're, I won't go into the ins and outs of it, but if you're worried about it, speak to your midwife or see a women's health physio like myself. And the other thing is listen to your body and rest for the first 6 weeks. I think there's a lot of pressure to snap right back, and I know as well, mentally people want to kind of regain their own body. They feel a bit lost. Their body's so different. But I think in like Asian cultures, it's amazing there. It's culturally acceptable that you do not leave the house for the first 6 weeks. And they generally, what happens is like the mother-in-law massages their stomach every day and binds it together, and they're not allowed to have cold shower that's hot only, that's to help with like healing and the nervous system. And yeah, I think they've been doing it thousands of years. There's a reason for that. I think us Western world people need to kind of cue into that and why they do it, and actually just listen to your body and rest. I think I've covered everything there.
I think you make a really good point though, of taking pressure off yourself to snap back. That whole idea of getting your pre-baby body back. It actually takes 6 weeks for the uterus to slowly deflate after birth anyway. So that 6-week time frame makes a lot of sense, I suppose, in other cultures. Your body's healing and it's been through massive transformation, and it's going to take time just to come back, and that's great advice.
Yeah.
So we do definitely have social pressure here, I think, in Western countries to pound back into life like we used to. And I'm hearing a lot with COVID that women are and their partners are enjoying the lack of pressure to have to head back out into the world as they normally would after they've had a baby, and the three of them can enjoy that time and bond, and it's slower. So
you know what? When I first went into isolation here, I was like, I think this is what maternity leave feels like. But you know what? I think it'd be a great time right now to be on maternity leave. Everyone's home to support. Yeah, it's not such a bad thing for everyone, is it?
No, there's been definitely benefits come out of the slowing of life, and I'm hearing it from my friends, and I'm hearing it from midwives too, who are seeing in birth suite how there's not lots and lots of people coming in post baby's birth, which gives the family real time to connect with each other, and it's a beautiful experience. That's from the coalface from these midwives, and was mentioned to me a couple of weeks ago, and it makes it just, yeah, it's not the big, oh yay, baby's been born, big, party atmosphere. It's quiet and settled. Women aren't as rushed to try their breastfeeding and get it out of the way because someone's out in the waiting room wanting to see them. So
yeah,
silver lining, I suppose.
Yeah, I suppose one thing I didn't add, which is the most important thing, is get your 6-week check with a women's health physio. I think I advocate every single lady should have a proper 6-week check, because I actually don't remember the last time a lady's come into me after having a 6-week check with her GP and him or her actually checking her pelvic floor. Even if she's had really big stitches, they don't check. They'll not, like, I know the priorities are different. Normally they'll be discussing the baby, but you can't really tell someone it's okay to go back to exercise and all these things if you haven't actually assessed the pelvic floor or the stomach muscles properly. So I'm a big advocate for that. And what we'd normally do as a women's health physio for the 6-week check is do a comprehensive musculoskeletal screen. So any back pain, hip pain, wrist pain, look at that, assess the stomach muscles, core strength ability, and then generally I'll do an internal examination as well, if comfortable, or we might use ultrasound. We've got the machine for those who are uncomfortable, and assessing, assessing for prolapse, assessing for healing, how are you contracting your pelvic floor, are you doing it right, are the stitches healed, are there scar tissue, things like that. I think it's really important.
Yeah, I do too. And look, I think you're right that people can think, oh, I'm the GP, I have to look this, and this, and it's looking at the holistic picture that's so important. And that's why I think these sessions are so valuable, because then women can have the education to empower themselves to know that I think I need to go and see Jess. I think I need to go and research about this a little more, rather than just leaving it. And often, like you say, it's not right then that the problems may play out. It can be later down the track, and you want to prevent that too. So
yeah, definitely.
Yeah. So yes, thank you, Jess, so much. I'm aware of time now, and I know you're busy. So what you've shared with us today is just so valuable, and I love that it's the majority of the talk has been around preventing and protecting the pelvic floor, and that's evidence that's worth knowing and sharing. So thank you so much. And sorry.
No, I was just going to say thank you so much for having me. I think I'm so passionate about talking about these things. It's just nice to be able to talk to you about it you're as passionate and be able to get it out there for everyone to hear.
And I know you've got so much more information too. You could be talking about pelvic instability and all these different things that come with pregnancy. There's so much to learn from you. So anytime you want to come back and share some more with us.
Yeah, definitely.
I love that. As we mentioned earlier, for more information, there are some resources available to us, to every Australian. You can hop online, and there's 2 organisations that Jess has mentioned to me. One is the Pelvic Floor First, or is it? Yeah, that's it, isn't it? Pelvic Floor
Pelvic Floor First, yeah.
Yeah, which is a great resource. And also the Continence Foundation of Australia has some great free resources, and we'll list both of those organisations on the Birth Sense Australia Handy Contacts page. And certainly if you'd like to see Jess and organise a telehealth appointment with her, we'll put Jess's details up on our Handy Contacts page as well, and you can access her expertise from home. So that's brilliant service. And I think something too that's come out of COVID that's great is that telehealth will probably become more and more popular. So so once again, Jess, just thank you so much, and I hope that what we've shared today has made the road to motherhood just that little bit more empowering, with the great education you've given us.
Yeah, thank you.
And thank you to everyone out there who's watched today. I'll be popping this up on Birth Sense YouTube channel. We've got interviews with experts and friends where we're aiming to get the right information from the right people out to you. So take care and see you soon. Bye.